Hi, it's Eric Dein from Jersey City, New Jersey, and I'm here at the end of Convergence after ACR 2023. It's been a great session, and it's been fantastic reporting with Room Now. I'm going to talk about some of the articles that were mentioned for ankylosing spondylitis. In particular, there's a great oral abstract session on Tuesday afternoon where they covered a lot of different topics. So the first topic that we reported on separately in Room Now was the new data for IV secukinumab being a great new option for our ankylosing spondylitis patients. Two abstracts subsequent to that I wanted to give a little bit more information for. The first one, abstract 2546, which is looking at anti-infliximab antibodies in ankylosing spondylitis. So this was a study where they looked at blinded the anti-infliximab antibodies in these patients. 45% of patients had anti-infliximab antibodies in their follow-up. 85% of them that had these antibodies, they presented in the first year. One thing to note, as we may expect, and something we know that is helpful, methotrexate definitely decreases the risk of anti-infliximab antibodies. So this decreased from 42% in the patients that did not have methotrexate to 18%. Anti-infliximab antibodies had worse prognosis, as you might expect. It had higher inflammatory markers, more infusion reactions, lower serum infliximab levels, and patients were more likely to be failures of infliximab. These were blinded to the patients and the doctor, so it did not impact their treatment decision, but they were more likely to be switched off infliximab. So infliximab survival curve showed that having an infliximab antibody is associated with a hazard ratio of 2.5 for failure with an antibody at 6 months, or failure of the drug at 6 months, or if you have the antibody at 1 year, your hazard ratio approaches 10. They then actually expanded it to look at patients that were doing well as to whether or not they could be tapered from infliximab. And they found that those with anti-infliximab antibodies are more likely to flare when tapered. So this shows that anti-infliximab antibodies, definitely a test that we can be utilizing. I know our GI colleagues probably use it more than rheumatologists. Certainly, our CSD-MARDs like methotrexate prevent anti-drug antibodies to infliximab. We certainly have the data for other medicines like pegloticase. And seeing those antibodies may mean, number one, they're more likely to run into trouble, and number two, tapering them may not go well. The abstract immediately subsequent, number 2547, looked at a different topic of difficult to treat ankylosing spondylitis. So this is definitely a topic that has had a lot of conversation in the meetings recently, that, difficult to treat RA being a big topic last year. And that diagnosis was often defined as failing 2 or more biologic or targeted synthetic DMARDs with a different MOA. So there's also a category of very difficult to treat disease when you fail those drugs in less than 2 years. The patients, when they looked at the ankylosing spondylitis and they saw how many people met that diagnosis, 28% were defined as difficult to treat, which is quite a big number. When you compare it to the RA patients, it's only 7 to 10%. So a lot more difficult patients in the AS population. Very difficult to treat was about 3.8%. So difficult to treat had more likely peripheral arthritis, uveitis, higher BASDI, and more likely to have fibromyalgia symptoms or diagnosis. Very difficult to treat, longer disease duration, higher CRP, also uveitis, and more likely to have inflammatory bowel disease. So these different manifestations beyond the spine. So I think it's really important we have this cohort, we come up with that right definition of difficult to treat, whether it's this one in the RA literature or something unique, that helps us really classify these patients, investigate these patients, and find the best treatment options for them. So a lot to talk about here from these abstracts on ankylosing spondylitis, and really a great session overall. So congratulations to the ACR for putting on a great convergence.